While eyes are fixed on Capitol Hill today, the Trump administration working hard to get Republicans on board for a replacement to Obamacare. The president will meet first thing tomorrow morning with House Republicans to make sure party members all on the same page, or as close as you can be. This morning, the president met with Dr. Zeke Emanuel, the architect of Obamacare, who continues to criticize the GOP health replacement plan. I'm joined now by Congressman Phil Roe, Republican from Tennessee, who serves as co-chair of the House Doctors Committee. Congressman, thank you for joining me. I get the sense, and people have told me, that there's a bit of a battle going on between moderate Republicans and conservative Republicans. And if you continue to try and appease the conservative Republicans, you're really going to have a problem with the moderates. How would you respond to that?
I think that's probably correct, what you pointed out, but I do believe we're going to get a consensus. And as you pointed out, the president will be with us at 9 o'clock in the morning to meet and sort of share his thoughts about how he feels about this plan. So, no, I think you've correctly laid out the problem we're having.
One of the things that, phasing out Medicaid expansion earlier. This is something conservatives would like to see. Repealing the requirement that insurers allow 26-year-olds, up to 26, to stay on their parents' insurance. Are these the kind of things that are very workable, or could they derail the whole deal?
No, I think the Medicaid expansion one is going to be phased out at some point in time, whether it's 2019 or 2020. And the 26-year-olds we pretty much all agree on. I think there would be a consensus for that. I think many of us agreed on that in 2009 and 10 when we debated the bill to begin with.
It's still pretty popular, though, isn't it?
It is, and look, I think most people, if they have kids like I did, all of my children had no health insurance when they got out of college, and I provided it, so I think most people would agree with that. I don't think you're going to find much argument there at all. I think that, look, I think what we're trying to do is expand coverage and lower costs and put patients and doctors back in charge of health care decisions, which is what the Affordable Care Act didn't do. It expanded coverage, but it massively increased the cost. And that's the problem around the country now, is people can't afford their insurance.
Senator, it's interesting. Critics say that, look, Obamacare shifted, I guess you could say, the financial burden from low income to middle class. What the new GOP bill would do was pass it right back from the middle class back down to low income. Would you disagree with that?
I would not disagree with that. What happened was, when you look at insurance ratios, how much you charge somebody for insurance, the ACA, the Affordable Care Act, basically what it did was shrunk that from 5 to 1 to 3 to 1. So younger people paid a lot more for their insurance. And the idea was many of them were going to go into the plan and lower the cost for older people. What happened was you got an older and sicker pool, and that's why it's falling apart. In my state of Tennessee, almost 160,000 people chose to pay the penalty of the tax as opposed to pay for insurance they couldn't afford. And that's what we're going to try to do, is to treat everybody fairly in this plan.
Very quickly, last question, Congressman. Does this thing get voted on and passed Thursday?
That's a great question. I think it gets voted on, and I think it gets passed Thursday.
Very good. All right. Sticking your neck out. Congressman Phil Roe from the great state of Tennessee. I lived in Nashville for 10 years. You can tell by my accent. Congressman, thank you very much. Appreciate it.